Now to that life-saving mammogram shift. A U.S. task force recommending lowering the age of a first screening from 50 to 40 years old. Now that group estimates nearly 20% more women will be able to survive breast cancer because of early detection. Paula Tutman took a close look at the numbers, and a very specific demographic stands out. She joins us now live from Henry Ford in Detroit to explain more. Paula, tell us about it.
Yeah. Hi, Karen. Hi, everybody. Yeah, you know what? Lowering that screening age was so critical, particularly for women who look like me. Now, there's a lot of research being done right here because there's a reason black women are more likely to get breast cancer and more likely to die from it if we do. And researchers are frantically looking for those answers, but they need more African-American women to jump in and help because of ultimately where we originally came from. The key is clinical trials, and here's the thing, you don't need to be sick to participate because data needs to be collected from black women in particular to narrow down the specific reason ethnicity is a factor in breast cancer.
And it's very important that we as black people participate in trials where we can look at the genetics.
Dr. Evelyn Giaghi and Dr. Eleanor Walker of Henry Ford Health have been leading one of the charges in researching the connection between why black women of African descent in particular are 40% more likely to develop breast cancer, and if they do, die at a higher rate. A particular concern, the triple negative breast cancer.
The participation widens the amount of genetic information we have that allows us to look at risk factors.
But there's fascinating information scientists are trying to narrow down about why American black women are more predisposed to getting breast cancers in the first place. And the answer could have something to do with the slave trade. Women in West Africa, in countries like Ghana, have the highest rate of breast cancer. Why? One way these physician researchers could get more answers is if more black women, in particular, sign up for clinical trials. And while many may think clinical trials are just to test medications, if you get a disease, nothing could be further from the truth. Because they need to follow healthy women as well to get a better understanding of genetics, environment, and disease progression, or even lack of progression.
Africa is where life started. So the diversity of genetics in Africa is really high.
And so the genetic material of the black American female, whose lineage may be from West Africa, may carry information that was useful to ward off malaria or some other diseases in that region, but on the North American continent could possibly have morphed into something else that triggers breast cancer. More research with black women could help narrow down the cause, the effect, and a better ability to cure anyone with breast cancer.
These are some of the things we're looking at and trying to figure out a way of how we can help improve outcomes and earlier diagnosis.
You know, so much of that interview and that information was just a wow to me, Karen. So how do women get involved in clinical trials, any clinical trials? Well, your primary healthcare provider can be your first stop. Just let them know that you're interested in volunteering, but also websites. Take a look, find out who's doing any kind of clinical trial, and then get involved. Karen?
All right, we appreciate it. Thank you, Paula.